Hi, my name is Juan Muñiz with AgSafe. This session will cover respirators for pesticide use. Disclaimer. The content of today's session is based on publicly available information. Such information is subject to change without notice, may be incomplete or condensed. Except where otherwise indicated, the information provided is based on matters as they exist as of the date of presentation. Such information is provided as general information on topics presented. Nothing presented today constitutes legal advice or opinion to participants or others attending or reviewing this material and is not a substitute for professional legal services. Every situation is different and subject to legislative activity and administrative or judicial changes in the law. You should also note that the views or opinions expressed by the presenters do not necessarily reflect the views or opinions of AgSafe. Objectives. 1. Identify when a respirator is required to be worn. 2. List essential requirements of a respirator program. 3. Discuss how to select the appropriate type of respirator. 4. Plan for the proper care of a respirator. Objective 1. How to identify when a respirator is required for a specific task. You may be asking yourself, what is the main source for identifying respirators to use and when to use them? The United States Environmental Protection Agency, known as EPA, sets the requirements for pesticide labels in the commercial agriculture sector under Title 40, Code of Federal Regulations, Section 156. In that section, called Precautionary Statements section of the label, which is one of many required parts of the label, it specifies when a respirator is required and the type of respirator. This section of the label also mentions other required personal protective equipment, or PPE, while yet other sections detail how to protect people, property, and the environment from known hazards during the use of the labeled pesticide. What hazards are identified in the precautionary statements section of the label? The precautionary statements usually identifies 3 hazards. The first are hazards to people and animals. The second is environmental hazards, and the third are physical hazards. In the hazards to people and animals, you will see a section for personal protection equipment and respirators to wear while handling containers, mixing, loading, and applying the product. It will also give you information on why the pesticide is hazardous to the user and provide any adverse effects from exposure. To the right, you see a sample section of a label of the precautionary statements. You will see at the top the hazards to humans and domestic animals, and we could read that sample. Causes moderate eye irritation, harmful if swallowed or absorbed through the skin. Avoid contact with skin, eyes, or clothing. So it tells us that is an irritation to the eyes, and it may be harmful if swallowed or absorbed through the skin. And then it tells us how to protect ourselves, and it has the personal protective equipment mentions applicators and other handlers must wear long sleeve shirts and long pants, chemical resistant gloves, including barrier laminate, butyl rubber, greater than or equal to 14 millimeters thick, nitrile rubber, also greater than or equal to 14 mils, neoprene rubber of the same thickness, natural rubber, also greater than or equal to 14 mils, neoprene, polyvinyl chloride, also greater than 14 mils, or Biton greater than or equal to 14 mils, plus shoes and socks. So as you can see, it's either going to be laminate gloves or a bunch of different types of rubbers, along with Viton and polyethylene and polyvinyl type gloves, all of which must be um, greater than or equal to 14 mils in thickness. Here is a closer look at that precautionary statement section. What is the difference between a mask and respirator? Respirators have a better filtering media and a better seal, which offer higher level of protection than masks. What is a respirator? The answer is a respirator is a device designed to protect the wearer from inhaling hazardous atmospheres, including fumes, mist, smokes, vapors or gases, and particulate matter, such as dust and airborne pathogens such as viruses. Please note that masks are not respirators. And below you have some samples. On the left, you see the surgical mask, and it progresses to a little better protection, which is the N95 mask. The second to the right, and the third to the right shows an equivalent of a surgical mask. It's a loose fitting mask similar to the homemade ones that you saw during COVID, but it's just, there's many different variations of those, and they could be just as effective or better than surgical masks. It depends on the material, the thickness. There's a lot of variables, but in essence, the surgical mask and the homemade mask are loose fitting and they're similar. The N95 would offer a slightly better protection because it does have a better seal with the face. And then as you move further to the right, you see a half mask and a full mask, which have better seals. So just remember that respirators tend to have better seals and they offer better filtering. Better seals and they filter better. It's the only difference between the respirator and the N95 mask. Levels of respirator protection. One, a surgical mask, which we just saw the samples, would be the loose fitting mask, would be the least protective. Then you would move on to a NIOSH approved or National Institute for Occupational Safety and Health approved particulate filtering respirator, which would be the equivalent of the N95s. And then the best protection are offered by air purifying and atmosphere supplying respirators. NIOSH approved particulate filtering respirators come in classifications. There are 10 different classifications that offer different levels of protection and resistance to deterioration by oils. These types of respirators use filters to remove particles from the air that is breathed through them. The N, R, and P designations refer to the filter's ability to resist oil. Here are those 10 classifications. Types of filtering masks. NIOSH approved particulate filtering respirators. If you look at the first column, you see N95, N99, N100. And if you look across from them, you will see the description. The N95 stands for 95% filtering capability of airborne particles. The 99 stands for 99% filtering ability. And the 100 corresponds to 99.97 effectiveness at filtering airborne particles. And you could see that the N code, if you go all the way across to the right, it ends indicates that mask is not resistant to oil. So if you're working in and around applications that have oils, and you get enough of those particulates lying around, it could start to deteriorate your mask. If you look as you go down from the left-hand side, you see the R's, the P type masks. Those are essentially the same filtering capabilities. The only difference is that R is a mask that is somewhat resistant, means that it will last a little longer if you're exposed to oils. And then the P is a strongly resistant to oil. It would, if you are going to be applying or handling oil-based products, that would probably be the best choice. And then at the very bottom of the filter class, you see HE, which stands for high efficiency particulate air filter. And that type of filter filters 99.97% of the airborne particles. Respirator selection. Title 3, California Code of Regulations, Section 6739C. We mentioned earlier that the precautionary statements section will identify and instruct us or direct us to use a specific type of respirator. So we will always use refer to the label as the ultimate legal authority for determining what respirator to use or what type. Only respiratory protection equipment approved by NIOSH will be used. So there are, the label will specify the type of masks or equipment, and will mention also the standard, either a NIOSH mask or sometimes they may mention other standards, but this is the most common standard that is mentioned on most of the labels. And so it must be approved by those standard setting organizations. Pesticide product labels will be consulted to determine the correct respirator for protection against a specific hazard. Regulatory requirements or permit conditions will also be referenced to determine the appropriate respiratory protection. So we mentioned that the label is the ultimate law that governs the type of PPE we should wear, but we should also observe any local requirements, such as your county ag commissioners, if you have special use permits, they may indicate other requirements to follow. So the NIOSH, National Institute for Occupational Safety and Health, is the federal institute responsible for conducting research and making recommendations for the prevention of work-related injuries and illness. So they do research and set the norms or the standards, and then the regulatory bodies will adopt those standards. And once they adopt them, once they refer to them in the regulations, then they become the required standard that must be used. There are also, as I mentioned, other standard setting organizations, and we will touch on that in the next slides. Debrief. The precautionary statement section of the pesticide label helps workers identify the specific PPE and respirator required for use during specific tasks such as mixing, loading, applying, or early entry. Objective number 2, summarize the requirements for a respirator program. What are the key elements of a written respirator program? So one of the first requirements for a respirator program is that it must be in writing. And then you have the requirements for a selecting a responsible party to administer the program or the plan. There must be that administrator must maintain records. There must be approved PPE information and how to select it. There must be information on medical evaluations, fit test, training, voluntary use information, cleaning and care, and then there must be the administrator must also make sure that they are reviewing. There's an annual review component to make sure that the plan is still working as it was designed. To the right, you see a sample respiratory protection program. The first page, the introduction. So the requirement for the respiratory protection is the Title 29 of the Code of Federal Regulations 1910.134. And that's just a sample there of the introduction page to a sample respiratory program. The requirements for a respiratory program, again, we mentioned the administrator. The administrator will, the respirator program will be in writing and identify the respirator program administrator, which is called the RPA. And that, again, respirator program administrator is responsible for ensuring that the effectiveness of the respiratory protection program and its compliance with the respiratory protection regulation. The administrator is also charged with maintaining all records associated with the program and making sure that that NEOSH approved PPE is being utilized and according to label specific information. Requirements for a respirator program medical evaluation. The medical evaluation is under Title III of the California Code of Regulations, Section 6739D, as in David. Employees required to wear a respirator must complete a medical evaluation questionnaire and get it reviewed by a physician or a licensed healthcare professional, also referred to as a PLHCP, which stands for a physician or licensed healthcare professional. We will refer to it as your doctor. The questionnaire will be completed confidentially by the employee and submitted to their doctor. Or again, the PLHCP or physician or licensed healthcare professional. Management will not read the completed questionnaire or assist the employee in filling out the questionnaire. The doctor will have to give clearance or a modified plan for respirator use to be authorized to do any related tasks that require a respirator. After the doctor has reviewed the questionnaire, or completed the physical examination, they will send the results to of the medical evaluation to the administrator and the employee. Requirements for a respirator program medical evaluations continued. The medical evaluation, the doctor will receive the following information to assist in evaluating the questionnaire. So typically the employer will provide details of the type of respirator, right? If it has a filtering face piece, if it's a half face or full face, if it's the scuba type mask or any other type of respirator, the weight of the respirator, the duration and frequency of use. Typically, this may include some sort of job description, expected physical effort, such as medium or heavy, expected physical effort while utilizing that respirator, additional protective clothing and equipment worn, such as Tyvek suits or coveralls, aprons, any other type of protective clothing that would be worn along with a respirator. Temperature and humidity extremes, they need to know the environment where it's going to be used. Copy of the respiratory protection program. That would be the internal written plan that we just mentioned, along with a copy of that regulation, the Title III California Code of Regulations, Section 6739. Also, just be aware that when a new or a different doctor is used, the administrator shall ensure that the new doctor obtains the necessary information by having the documents transferred. This organization shall provide subsequent additional medical evaluations if any of the following occur. If the worker reports medical signs or symptoms related to their inability to use the respirator, if the doctor, supervisor, or the administrator informs management that a worker needs to be re-evaluated, information from the administrator, including observations made during fit testing and program evaluation, indicates a need. Changes in workplace conditions that may substantially increase the physiological burden on the worker. Requirements for a respirator program continued. Respirator fit testing. That is found under Title III California Code of Regulations 6739E as in Edward. And there are usually two types of acceptable fit testing. Qualitative is one of them and quantitative is another. The qualitative fit testing follows protocols found in Cal OSHA Regulations, Title 8, California Code of Regulations, Section 5144. Appendix A cited in the DPR regulation Title 3, California Code of Regulation 6739, Section E4 are approved for qualitative fit tests. Basically, that section will give you more details on the type of testing and equipment and process that is used. So below are some brief descriptions of such. So for respirators, for testing against chemical cartridges, typically there is what is called an isoamyl acetate test, and there is a banana oil type agent that is used while the user is dressed in with their protective masks, and they're usually isolated by a hoodie, a room of some kind, and basically what it allows us to do is to determine if that person can detect that specific scent of that oil while wearing their mask. That would be one type of qualitative test. And I'm sorry, of a qualitative test. The second one is for testing against particulate filters. There may be a test called the saccharin test. Um, it's Bitrix test. There is an irritant smoke test that is used. If they can detect that irritant, then that would indicate that the seals are not, or the filtering device is not working properly. So if there's a detection of a smell or an irritant, so in the case of the banana oil, if there's some smell, in the case of the irritant, right, if they detect that irritant, then that means that either the filtering device is not working properly or the seal is not providing a proper seal, and that would indicate a fit test not passing. So in essence, uh, they would need to not be able to detect when they're exposed to those the oil or the irritant. In all cases, the respirator wearer should select a respirator that feels comfortable. If there are any doubts about the condition or integrity of the selected respirator, the respirator will be rejected. As required by the regulation, all fit testing will be done in accordance with the requirements found in the California Occupational Safety and Health regulations. Title 8, CCR, Section 5144 that we just mentioned. Respirator fit test continued. The quantitative fit testing, the following protocols found also in Cal OSHA regulation, Title 8, California Code of Regulations, Section 5144. And again, Appendix A will detail the equipment and the type of acceptable testing mechanisms for a quantitative test. For respirators, there are usually generated an aerosol, usually corn oil salt or DEHP. There's a condensation nuclei counter, porta counter, and controlled. So those would be the types of quantitative tests, and then also negative pressure, a CNP. So the detection of small amounts of leaks in the protective mask must be within tolerance allowed by the regulation in order for them to be to pass. So in this case, the equipment will detect small amounts of leaking in the seal, and the leaks that are allowed to enter that mask have minimal acceptable tolerances or limited amounts that are considered safe. If that leak is greater than those minimum allowed limits, then technically they would not pass that test. And so you would need to look again into a better filtering cartridge or double check all of the seals. Requirements for a respirator program continued. Instruction and training under Title III, California Code of Regulations, Section 6739M as in Mike. Employees who are required to use respirators must be trained such that they can demonstrate knowledge of at least the following. One, when and why the respirator is necessary and how improper fit, use, or maintenance can compromise its effectiveness. 2, limitations and capabilities of the respirator, including if the respirator malfunctions. 3, effective use in emergency situations. 4, how to inspect, put on, remove, and use and check the seals. 4, proper maintenance and storage. 5, recognition of medical signs and symptoms that may limit or prevent effective use. Training will be conducted annually, and training records will be kept by the administrator. If you change respirators, this means if you, for whatever reason, decide that after you have been fit tested and you've been working, for whatever reason, you decide to go from either a half mask, just like the ones we have pictured here, you go from using the smaller half mask on the right to using the one with the cartridges here on the left that includes seals that the entire face, or any other variation other than your initial fit tested equipment. If you change into any other type for whatever reason, then you need to repeat your medical evaluation. So your medical evaluation is only good for one piece of equipment. It's usually identified on your training records. And so anytime there's any changes, you will have to go and have another evaluation done, and they will document, your team or whomever is providing the fit test will document the new mask that you're going to be using. You need to repeat the fit test. You need to receive additional training that corresponds to your new respirator. That is before you wear the new respirator for any work-related task. Debrief: a respirator program must be in writing, must identify an administrator in charge of managing the effectiveness and compliance of the program. Records must be kept, and there must be an annual review of the program to make sure that it's still effective. Objective number 3, how to select the appropriate type of respirator for a task. You must wear a respirator anytime the pesticide label, California's rules and regulations, or your employer requires one. If the label tells you to avoid breathing dusts, vapor, or mists, and you cannot do this, then you may also need to wear a respirator. So basically, the label again is your ultimate reference, is the law, and then California or any other local requirements, such as your county ag commissioner and any special permitting, or your employer, whichever is the strictest, that's what we ought to follow. And if those are not clear, anytime that the label specifies that you should not be breathing those dust, vapors, or mist, that would be a clear indication that you must wear some respirator protection, and you would have to cross-reference all that, whatever that material is, to determine what the best respirator for that task would be. But just remember that the label is the main source for choosing the right respirator to use and when to use it. Learn to understand the respirator information on the pesticide product labeling. How to select the appropriate type of respirator for a task. There are 4 steps for selecting a respirator as follows. First, which we've already mentioned, is refer to the precautionary statements section of the label. Find the part of each product labeling that specifies the type of respirator protection that must be used by the handler for that product. Sometimes there are different respirator requirements for different activities, such as mixing and loading versus application of the product. 2, respirators come in 2 types, either atmosphere supplying or air supplying. Atmosphere supplying or air purifying. They are assigned NEOSH TC numbers, several styles based on the label. A non-powered type operates as the user breathes air through the filter. These are typically NIOSH TC-84A or TC-14G. We'll have a sample or a picture of this shortly. 3, filter media comes in chemical cartridge or canister and filtering type, as we mentioned earlier, the NPR or HE type particulate filters. 4, the protective barrier between user and contaminant can be loose fitting or tight fitting. Here is a sample or a portion of a sample of a label from Gramoxone SL 3.0. And if this would be in the precautionary statements section, you would read right below that, you would see personal protective equipment, and notice that it says applicators and other handlers other than mixers and loaders would need to wear long sleeve shirts and pants, shoes and socks, protective eyewear, chemical resistant gloves, and it specifies all the different types that you can pick from. Specifically, right, different types of rubbers that must be equal to or greater than 14 millimeters thick. And then if you look at the very last bullet under there, it says NIOSH approved particulate respirator with any NR or P filter and NIOSH approved number prefix TC84A or NIOSH approved power air purifying respirator with an HE filter, which we mentioned was a high efficiency filter, with NIOSH approved number prefix TC21C. So it tells you that you could use either one of these, either TC84A or TC21C. One of them is a filtering type respirator, and the other one is a power air purifying respirator. And so for applications, you would follow those choices. And then if you look below, for mixers, again, it gives you their protection required PPE. And if you look at the fourth bullet from the bottom, it mentions again also the same type of options for respirators. And here is the samples, the levels of respiratory protection. The most protective start here at the from top to bottom. So we mentioned the TC84A is right here. So that means it's one of the ones that offers the most protection, right? It is NIOSH approved air purifying full phase respirator with combination of cartridges and particulate filter. So most of these, you'll see OV there, that's for the organic type canisters. And then the N type are like the N95 media that goes in here. It's a different type of filter, but it's still the N type, which is just like a N95 media that goes in these cartridges, in the pre-filters. The other option that they mentioned was the TC21. So see, actually there it's a little less protective according to the level of protection. We said the best one started at the top and we moved down. So that means that the 84A, the purifying full phase, would be actually better than this one. The air purifying respirator is the TC21C. So it's a power air purifying respirator, PAPR, which are the ones that use the high efficiency filters, HE filtering filter, right? So that is why that one over here is a little more, offers more protection, because it's a combination of an organic carbon type organic carbon type filter along with a filtering media. All right, so that's why this one would be a little bit better. This one just has the high efficiency filters, and that one has the organic carbon filters along with the pre-filter. How to select the appropriate type of respirator for a mask. When must respirators be used? The answer is when the label requires one, or when a worker must be protected from harmful exposures to airborne hazards and or oxygen deficiency environments. These conditions require the use of a respirator can exist in open areas, such as farms, or enclosed areas, such as greenhouses. The most common example is when using fumigants, mists, aerosols, or smoke treatments. Posted warnings will indicate the need for respiratory protection. How to select the appropriate type of respirator for a task. What is considered harmful exposure? The result of exposure above limits can result in injury, illness, disease, or impairment. So there are certain limits that would be predetermined by regulatory bodies, which if they're exceeded, they will result in injury or impairment. So that is what harmful exposure means. The limits by the CDC, California Department of Public Health, and county respiratory viruses such as COVID and others. Limits by Title 8 of the Code of Regulations, Section 5141.1. And then there's all that's for wildfire smoke, has limits under Title 8, California Code of Regulations, Section 5155, airborne contaminants, including dust, fumes, mist, vapors, and gases. There's also concentration ceilings that are set, or maximums. There could also be permissible exposure levels, PELs, and there's also other ways that they are referenced are short-term exposure levels, or STELs. These are all are already predetermined by our regulations and some of these other regulatory bodies. What is considered voluntary use? Voluntary use of a mask respirator is allowed when all the following conditions have been met. One, an employee requests a respirator even though the use of one is not required by the employer. Okay, so that means that there was no regulatory requirement, there was no exposure to hazards that triggered the employer needing or having to provide one, but the employee request one anyway, so that would be voluntary. Two, Cal OSHA standard does not require one, and you have determined that its use is not necessary to protect the health of the employee. So again, OSHA does not have any standard for it, and the organization has deemed that there is no health danger to the employee, but the employee requests one anyway. They choose to wear one. It will not, and three, if it will, wearing that voluntary mask or respirator will not in itself create a hazard. So that means that if the employee chooses to wear that mask and there is no regulation that has triggered the requirement for a mask or respirator to be provided by the employer, by providing that mask, we are not creating a hazard for that person. So that is what voluntary use is. If there is any hazard associated with it, well, then it would no longer be voluntary. Okay. Note, voluntary respirator use will require medical evaluation, written procedures for cleaning, storing, and maintenance, and training per Title 8 of the California Code of Regulations 5144. So those things are all still required, right? But voluntary use for masks do not require a written plan. So we don't have to have, employers do not have to have a written plan, but they do need to have the medical eval procedure. They need to show people how to clean and store and maintain and train how to use them. But they do need to require information. There's some a form that provides more information on this code 51 section 5144 that we just mentioned, that is required to be provided to the employee so that they know the associated hazards and how to protect themselves. Um, but again, no written program is required. Debrief. The label identifies specific respirators and other PPE for each task. Respirators are paired with cartridges or canisters and filter media based on the type of masks and system used, and is also usually governed by the label. NIOSH standards must also be observed to secure the best protection. Objective number 4, how to plan for care of a respirator. To care for a respirator, follow these steps. 1, provide workers with a clean area away from contaminants to store clothing and unused PPE. 2, if PPE will be reused, clean it before each day of reuse according to the instructions from the manufacturer, unless the pesticide label specifies other requirements. 3, if there are no instructions or requirements, wash PPE thoroughly in detergent and hot water. Liquid detergents are best for breaking down oil-based products. 4, thoroughly dry and clean PPE before it is stored or put in a well-ventilated place to dry. It is best to develop cleaning protocols and also inspect before and after use. And while inspecting or cleaning, you can make repairs as needed immediately. Always make sure to use only mild liquid detergents and water, and avoid rubbing. Eye protection. The exterior of PPE may be washed with a soft cloth or a soft brush, but always follow manufacturer recommendations. Avoid using abrasives and alcohol for cleaning. How to plan for care of respirators. Proper storage of respirators. Clean and dry respirators must be protected from damage, so make sure that you have a designated area so they are not smashed or deformed from weight of other items on them. Avoid getting other contaminants on them. Any dust. You must also avoid direct sunlight and heat, temperatures, which can deform some of the seals. Moistures, chemicals, and deform. All these or a combination of these things may help or may actually affect the valves and face pieces. It is best to store in paper bags and inside storage bins while keeping in mind all of the above. Emergency respirators must be kept accessible to the work area and stored in compartments or in covers that are clearly marked as containing emergency respirators and stored in accordance with the applicable manufacturer's instructions. How to plan for care of the respirator. Respirator routine maintenance. Handler employers must replace filtering facepiece respirator filters and/or respirators. 1. When breathing resistance becomes excessive. 2. If the filter is damaged or torn. 3. When the respirator manufacturer or pesticide labeling says to replace them. Or 4. At the end of a maximum of 8 hours of cumulative use, if no other instructions are indicated of service life are available. A change schedule is the part of your respiratory protection program that determines how often cartridge canisters must be replaced and which information are relied on to make these determinations. So again, in your plan, you must have a predetermined schedule, regularly occurring maintenance for your respirators. How to plan for care of the respirator. Handler employers must replace gas and vapor removing respirator cartridges or canisters. 1. At the first indication of odor, taste, or irritation. 2. When breathing resistance becomes excessive. 3. When the respirator manufacturer or pesticide label says to replace them. Or 4. Based on data-driven change-out schedule that ensures canister and cartridges are changed before the end of their service life, if no other instructions or indications of service life are available. Note, end of service life indicators, also referred to as ESLE, are not very common due to limited test and limited data availability. So some manufacturers, such as the sample pictured here on the right, they come with built-in end of service life indicators, but they are just not reliable for all the different combinations of mixes that most people are applying, and so they may not be as reliable. Brief. Employees should have a place for storing and cleaning their respirator if reusable. Employers' written program should outline how to identify the useful life of a filter or cartridge canister for a respirator.